Hello and welcome. My name is Kari Barclay. I use they, them, or he, him pronouns. I am the Community Engagement Coordinator for the San Francisco Mime Troupe and glad to be talking to you all today. The San Francisco Mime Troupe is a Tony Award-winning activist theater group whose usually you'll find in the park performing musical political comedies, speaking truth to power. We may be the mime troupe, but we are almost never silent. I'm grateful for you all for joining us for a panel today to talk about healthcare and justice under the title Healthcare is a Right. Before I get started, I want to first acknowledge that the Mime Troupe studio is in San Francisco on Ohlone land, and to recognize the indigenous land on which we're all existing. I'm broadcasting from Ramahesh Ohlone land in Berkeley, California. And if you would like to make an acknowledgement of the indigenous land that you are on, I welcome you to do so now in the chat. We're going to have a conversation today about our second episode in this summer series, which is called Tales of the Resistance. And we're releasing 9 episodes that are each their own little musical radio play about a different topic related to politics, related to activism, related to community and life in the current era in which we're living. And we're releasing those throughout the summer and into the fall. And for each of our episodes, we'll be having a talk back like the one that we're doing today to discuss some of the issues presented in each episode. As well, those are all accessible on our website, sfmt.org. And as well, we have for just until tomorrow, one of our past plays from 2015 called Freedom Land, which is a take on race and policing in America and in our own communities, that is available also through our website, sfmt.org. So make sure to check those out. I would like to start by introducing our guest, Marie Cartier, who is a collective member with the San Francisco Mime Troupe. Welcome, Marie.
Hi.
If you can introduce yourself and tell us how you started getting involved with the Mime Troupe.
Sure. My name's Marie Cartier, she, her pronouns. I first got involved in the Mime Troupe really as a child. It was a July 4th tradition for us to go see the Mime Troupe show in Dolores Park. I'm born and raised San Franciscan, so it was always really integrated into my early political and artistic consciousness. When I was a sophomore in college, I got to spend a summer as an intern, and then they couldn't really get rid of me after that. And now I'm a collective member. I've been a teaching artist, props artisan, scenic painter, and now this year, co-writer and doing a little voiceover work as well.
Great. And I know you do sort of other theater and performance work around the city as well. If you could talk about some of that, just to give us some more context on who you are.
Sure. So one thing I love about theater is that it has so many different components and so many different types of work that go into it. So I've been really lucky in that I've gotten to do a lot of different types of work. The last job I had before the shutdown was I was a technician at Oasis, the premier drag venue in San Francisco, and I got to run the lights for the club there. And I should mention, I'm also in grad school for social work. I'm pursuing my master's in social work at Cal State East Bay. So it was kind of an ideal grad school job because it's nights and weekends and also just a very fun, different environment. I really miss it. And then also I founded a company sort of using the Mime Troupe as a template because it's collaborative with my sister and some friends, and we're a woman-led company called Bow and Arrow Circus Theater Collective. So we were also planning a big show for April called Dark Side of the Circus. That is indefinitely postponed, but we are working on coming out with some virtual content currently.
I've been to bow and arrow shows in the past, and I highly recommend you check them out. They're really fabulous. So we are gathered here today to talk about healthcare and all sorts of elements of justice. So first off, I would like to go ahead and play a little excerpt from our show. And so this episode 2 is Novice Nurse, Susie Terse. And so here I would like to share with you all a little bit of it from that is our protagonist, Susie Terse, who's a nurse who always speaks her mind. And she is in conversation with an administrator at the hospital where she works. So I'm excited to share this. Oh, okay. It is not letting me share audio, but let me see if I can make this work. Here we go. Technology. Okay, there we go. Thank you very much. And as well, an enormous thank you to our folks at San Francisco Public Library for making this panel possible.
Yay, the library. I miss you.
Yay.
I miss you, library.
That library and civic center. I was always go to the main branch and work, and I miss it these days. So I'm now going to share my audio, and here we are with a clip of novice nurse Susie Terse.
Ah, Nurse Terse, won't you take a seat?
No.
Ah, yes. Well, I wanted to talk to you about an incident involving you and a patient, a Mrs. Henderson.
Yes?
According to our witnesses, Mrs. Henderson came to our emergency room with a laceration to the forehead.
She slipped in the shower.
And you treated her.
Yes.
Yet when you finished with her, her contact information went missing, making it impossible for us to bill her for our services.
She didn't have insurance, and her bill would have been thousands of dollars for a couple of stitches.
This seems to happen a lot with your patients.
Yes, it does.
Aha!
Aha, what?
You admit you helped Mrs. Henderson by deleting her information?
I didn't admit that.
So you didn't do it?
No, I did. You just hadn't asked me about it yet.
Aha!
I wasn't hiding it.
Why did you do it?
An inability to pay should never come between a patient and their health care.
This hospital never refuses any patient.
How many sick and injured people don't even come to the hospital because they know they won't be able to afford the bill?
Look, we all want to help.
No, I want to help. You're here for the money.
That's not true.
Yes, it is.
You can't just say that.
I just did.
Do you know what is needed to run a hospital?
A medical staff, a medical support staff, and supplies.
Yes, well...
What it doesn't need is a profit margin.
You can't say that.
I just said it.
Well, stop saying it. The fact is that by deleting records, you in effect stole from this hospital.
I paid for it.
You what?
The actual cost of Mrs. Henderson's treatment was $87.53. That's what it cost us. That's what I paid.
It's not about how much it actually costs. It's about the hospital being prepared to do everything.
That's ridiculous.
It's the way it is.
That's like going to a restaurant, ordering one thing, and then being charged for the entire menu because the chef was prepared to cook everything.
Look here, young lady.
But there is one thing that could help us deal with all the Mrs. Hendersons and all the little Marcuses of the world, and maybe even this pandemic of COVID-19.
COVID-19?
COVID-19, a disease for which there was no cure and no vaccine.
What could possibly help with all of that?
National health care.
National health care?
National health care, just like the other top 50 industrialized countries of the world.
The only way to take care of our national health is to pay for it with our own common wealth. And if we want to look out for our national welfare, the easiest way is with national health care. A health care system built for health care rather than profit. Medications, births, operations, emergencies. Free, free, free.
Stop saying free.
Free.
If we weren't low on nurses right now, I would have you fired.
Well, you are, so you can't.
You'll regret this, Nurse Terse.
No, I won't.
Get out.
Nurse Susie left Administrator Johnson's office more determined than ever to help the sick and needy. But then she saw good Dr. Janice in the hall.
All right. I'm going to leave you there on a cliffhanger. What's going to happen with good Dr. Janice? Listen and find out. Excellent. I want to ask Marie, how did, sort of in your conversations with the troupe, how did folks land on doing an episode about healthcare at this time?
Well, the short answer is that because that's what's going on. I think even before the pandemic, that was a big debate. You know, obviously in the Democratic primary, there were a lot of different opinions on that. And then COVID hit and it really just revealed all the inequities around healthcare that we have. Especially, I remember initially there were no tests. The tests were like really expensive. So it became clear very quickly that would have to be a big part of the show. One of the things about us is we don't write super ahead of time. We try to write as close to the bone as possible so that it can be as up to date as possible. So earlier in the year, we were talking about doing a show that's focused on the election because that seemed like the biggest thing that was going to happen. And then COVID hit, and then this fresh wave of uprisings around Black Lives Matter and questioning the police happened. So we're trying to do a little bit of all of that in there.
Yeah, and we'll talk a little bit later about the intersection of thinking about public health in relationship to policing, which has been a big conversation right now. And one of our guests, Rupa Marya, who works with the Do No Harm Coalition, is trying to resolve internet troubles right now, but she will hopefully be able to join us a little bit later in the episode. She as well will be able to talk about the link between health and policing. So I'm grateful for us to be able to have that conversation. Yeah, I'm curious as well. I think that I think that Susie Terse as a character is so funny. Of this character who will just say exactly what's on her mind, and like she'll say something and then somebody will say, "You can't say that," and she said, "I just did." And I think that I'm really interested in sort of her development as a character. Do you have any insight into like how that happened, or is that somewhere in Michael's brain?
I think it's like mostly in Michael's brain. The way I interpret that character though is very representative of like the younger generations, like millennials and Gen Z, who have just grown up in this world of so much bullshit. I can swear on the internet, right? And so there's no euphemizing anymore. We say we live in a police state. Like we need to stop, like the police need to stop killing Black people. Like there's a way you can just cut through the noise that I think is kind of like a fresh and like a younger perspective. So that's how I interpret her character, as being the person who grew up, you know, with the Iraq War, with the 2008 meltdown, with now Trump being elected, all these things. And she's had it, and she sees no reason to euphemize.
Totally. And that tendency to just say what's on her mind totally gets in the way of sort of the for-profit medical system and its tendencies to try to cast things in a very like nice PR light of, we're caring for people, we're making sure that you're prepared. But at the same time, now during COVID-19,
always three in the episode.
Always three. During this time, like we're seeing how even a system that purports to be serving everybody is at the same time neglecting those who are at the margins of our society, neglecting those who are unable to pay for services, just like in that clip that we heard. And something that, part of the reason that why we're interested in national healthcare or free healthcare is thinking about like how, when it isn't in capital's interests and when it isn't in corporate medicine's interests to serve people, how can we still be able to provide them with support? And there are organizations, I think, around the Bay, and there's like a long history in the Bay of organizing around being able to provide free medicine to folks. You have groups like the Haight-Ashbury Free Clinic or the Berkeley Free Clinic. I know a little bit more about the folks at the Berkeley Free Clinic, but something that they've been doing is providing free services to folks who are without housing right now, and they've been able to install hand washing stations, trying to link them up with housing in this moment, just trying to think about what free medicine would look like in our country. And even in the absence of a federal system, being able to provide that in this moment, thinking about how, as a kind of network of mutual aid, as a group of neighbors helping each other, we're able to support each other in this moment. So I find that exciting.
I can't say I am an expert on the various organizations that give free healthcare, but I did work in homeless services for 3 years, and that was what inspired me pursuing my MSW. And there are so many barriers to getting on Medi-Cal if you're not housed. Like you need a mailing address, you need all these things, and then you need to also be able to make appointments in a existence that is very uncertain and very like changes from day to day. I had some very interesting experiences trying to advocate for clients who were trying to access healthcare. I got like yelled at by an ER doctor once saying, you need to take this woman to her primary care provider. It's like, we've been trying for months to get her on Medi-Cal. Like, she doesn't have a primary care provider and she's very sick. So yeah, and then I'm also, as a low-income student, I'm a Medi-Cal recipient currently. And honestly, for me, it's great because I don't have any underlying conditions or anything. I get free prescriptions, I have UCSF doctor. So it gave me a little taste of like, maybe this should be how it is. Maybe we should all just be able to access the things we need. Like that couldn't be so bad, right?
Yeah. I'm curious, do you think COVID-19 and sort of the national discussion, I didn't say it 3 times. Do you think COVID-19
It's okay.
I think it's all right for this panel. Do you think that this is going to change the national landscape of healthcare in terms of, do you think there's going to be long-term change in how the US does healthcare because of COVID? And I know again, it's
hard to say. I mean, I think a lot depends on the election. I think it's really unfortunate. We have a Democratic candidate who still hasn't embraced universal health care during this pandemic. I think it's something that more and more people are going to be open to and are going to advocate for. And there is some hope there. I wouldn't be able to make a prediction if we're going to be able to do it anytime soon. I hope so.
Yeah. I'm hoping that this moment, like the Mime Troupe episode on this nurse, is able to like make us value care workers in a different way, and the folks who provide the necessary services, again, on the front lines for our community. And something that I am encouraged by is, I think just a day or 2 ago, Joe Biden announced a plan to fund care workers for sort of across the country, be this both for childcare and for care for disabled folks in our society. And that's been kind of a push that people have been making for years. And I think I think the need to value and actually compensate care is such a necessary push. And I'm hoping that that valuation of work, of this work that's been historically undervalued, might actually sort of wake people up to some of the needs in our world.
Yeah, well, once it becomes, because it's what we call women's work, right? It's not exclusively in the domain of women, but historically it has been. And it's extremely undervalued and it's extremely skilled. Childcare is an extremely skilled field. So is elder care, and it's so underpaid. And if we start having a conversation about like, what if I think COVID has revealed, right? Like who is essential and who is not. And not that anyone is inessential, but there are certain jobs that like we would really, really be in a bad situation if people stopped doing those jobs. And so hopefully that will show something around like, why are the hourly wages for these jobs so low? Why are they not like regarded well? Yeah.
So fingers crossed on that. And this is also why we need to keep pushing. We need to keep advocating. And so, I do want to bring us to one of the parts of the episode, which is that on her way to deliver the key ingredient to the vaccine to stop COVID-19, Susie Terse finds herself in the middle of a Black Lives Matter protest. And in the midst of that protest against racist policing, she ends up getting arrested and is trying desperately to bring this ingredient across town to the Crosstown Medical Clinic. I'm curious, like, from what how have you seen, how did you and the other folks in the troupe think about linking these two issues and like thinking coalitionally, thinking like about bringing these two topics together in the episode?
Well, the plan is to have all the episodes link in a very exciting culmination at the end of the series. So we wanted the issues to be weaving together early on. And I think the thing to keep in mind is like the Mime Troupe stands for revolution. Like we don't stand for like a few policy changes in one area, which can be good and can show progress, and that's great too. But we always want to be thinking a lot bigger. And from my end, I don't want to speak for the movement, but like Black Lives Matter, from my understanding, it's not just about police violence, it's about systemic racism. And that is in healthcare, that's in education, that's in employment. And those things manifest both in access and in the way people are treated in those systems. So to have those sort of connections being made early on in the series is important, because often the conclusion we come to is to change one thing, you have to change everything. And that's not a quote from me, that's a quote from a famous abolitionist. Yeah, so that's part of what we wanted to talk about, and how like we're also all people living in society together. There are nurses who are coming out and protesting in their scrubs, and like in Portland, there were nurses out last night. So a lot of these people who are on the front lines are actually also like the biggest advocates for reform, because and change and abolition, because they see how these systems work on people.
Yeah, and there was a time in which during the protests in June in particular, I think some people were trying to pit the protests against public health and try to imagine that, oh no, we have all these people congregating in one place, like that's totally against that's against our procedures to make sure COVID doesn't spread. But I found a lot of people in the medical profession said, well, no, like police violence, structural racism, these are medical issues. These are public health crises, frankly.
Mm-hmm.
And actually refusing to take the bait of trying to divide issues and trying to act like they were entirely separate. So I was really encouraged by that. And something that the Do No Harm Coalition, I'll sort of bring them in, and we'll see if Rupa's able to make it today. Hopefully the Wi-Fi gods pull through. But what they are a group of folks in the medical profession, doctors, nurses, folks who again are serving our communities through a health standpoint, who gathered together, I believe, starting in the year 2015, to stand in solidarity to oppose police violence. And they emerged specifically after an incident around, they called it like the Frisco Five, so a pretty like significant case of police violence. And since then, they've been organizing in our community, and since particularly since COVID hit, they sort of have been mobilizing doctors and nurses again to show up at the Black Lives Matter protests, to be there for communities. People as well have just been coming out and like offering masks to people at the protest, to like be able to say, look, we're providing for our community's own health in some way, and we're doing mutual aid as folks have always done. The other thing I'll add to link, make sure we're thinking about the criminal justice system in relationship to public health, is the huge threat in our carceral system right now. Hi, I think we might have, Rupa might have been able to join us.
Hi.
So sorry, I've been having internet issues this afternoon, so I'm so sorry.
Well, we're very grateful to have you.
Yeah, we're glad you could make it. Thanks for being here.
No trouble.
Yeah.
What
have I missed?
So we shared a little bit of our episode from the Mime Troupe, which is, we call it Novice Nurse, Susie Terse. And it's an episode on, that's about social justice in relationship to healthcare. And we were just starting conversation around policing and health, which is actually kind of a good transition into talking about Do No Harm and your activism work. But yeah, we were talking about how racial justice and an equitable health system, and a health system that doesn't just work for profit, is a necessity for realizing racial justice in our communities. So yeah, would you mind introducing yourself and giving us some perspective on the Do No Harm Coalition and what you all do?
Yes. So I, first of all, just want to say I love the San Francisco Mime Troupe. I'm a big fan of you. You all have been a part of my political education and evolution and love of our community in San Francisco since I was really like a teenager. So thank you for the work that you do. I am a physician at UCSF. I'm an artist also. I'm a composer with the band Rupa and the April Fishes. And it was the work between at the intersection of my music and being a community member in San Francisco that really galvanized my work into understanding issues around state violence, who suffers in our societies in all ways. So the same people that are impacted by COVID are the same people who suffer at the hands of the police, who are the same people who suffer with our housing crisis, our crisis in greed that we have in San Francisco, because there's plenty of homes, plenty of units, just a crisis in greed, as we see with the mayor withholding all those hotel rooms from people who are languishing in the streets during this pandemic. And so I really see the structures that we're looking at also within healthcare as colonial structures. These are structures that were put in place at the time of the birth of capitalism, when the commons were enclosed in Europe, when we were moving from a feudal society to a capitalist society. That required a really intense restructuring of power in European culture that was then exported all around the world. So at the same time, were women's places of authority as medics, as healers, women's places of authority in tending the commons, the places where everybody got, food, shelter, and medicine from the forests, from the waters. These things were, radically changed in order to further a capitalist agenda, which required labor, so lots of slaves, or denigrated working class people, and lots of land, which is how we got to the land theft of here, Turtle Island, and all over the world. And I mention this because we have to understand that these structures are coming from a 600-year place, and they're the structures that actually impact medicine as well as policing. So it's not like medicine is this great bastion of racial equity. It's not. So, even the place that I work, which is very enlightened, UCSF, we see examples of medical racism all the time. And we have our own work to do, because even, if someone does have access to healthcare in our for-profit healthcare charade that reinforces a racial apartheid in medicine, even if you do get a person into the healthcare system, they're still subjected to the same structures within people's minds. And so that's really, where the work has to be simultaneously in restructuring our society and changing people's minds, like restructuring our minds, which is where the arts come in, and which is why I'm so grateful to the work that you all do, because that is the work of artists, is to help us restructure our minds.
Thank you so much. Yeah, when one of the things that this episode does is, in centering that nurse at the core of the story, she's trying to provide healthcare to folks throughout the time, and she constantly finds herself butting up against the for-profit medical system and trying to work with hospital administrators who have one set of priorities, she has another set of priorities, and she's trying to balance what you were saying, that like force of wanting to be a healer, wanting to bring in be a force for good, but running against the challenges of the for-profit system and the structural racism that she encounters there. So yeah.
It's not simply just the racism, it's the entire structure is so violent. So I call it financial abuse. Like, I'm with my patients regardless of their race in the hospital, and the people, when they're sick, they're having to call their insurance companies and make sure that this is okay, make sure that that's okay, and they're not going to be forced into debt, which, a majority of the cases of personal debt in the United States are medical bankruptcy. Majority of the cases of bankruptcy. So even if you are, white, Like, this is impacting everyone. It just more disproportionately impacts people of color and poor people. So yeah, so like, how do we be healers in a pathological system? How can we actually be healers? And I would argue that we can't actually effectively do our jobs without changing the structure of that system, which is why Medicare for All is absolutely urgent and important right now more than ever. Because in the pandemic, you want everyone to come to care and everyone to feel they have a right to access that care.
Yeah, we were just talking earlier about whether we think that the pandemic might shift people's perspective towards thinking about single payer healthcare, and sort of all folks are, well, we're hoping that folks potentially might see the inadequacies of the system in this moment. And I know speculation is always hard, but do you feel optimistic that this time is going to change the way that people see healthcare in the US?
I do believe it will, and it won't be pretty, because it will, a lot of people will have to suffer to get to the point of breaking through the narrative that somehow it's communist or bad to give people healthcare. So I think that we will have to reach a level of desperation in this country, and COVID is pushing us there, where we see that the suffering of one impacts the suffering of all. That if you are in San Francisco and you crush the curve of COVID, but you leave 6,500 unhoused people in the street when there are hotel rooms available for them, well, what are you going to get? You're going to get COVID rebounding. And they're like, why is this happening? Well, you can't really address this virus if you leave your most vulnerable people exposed. And that means the essential workers who could not shelter in place. That means the people who are living 8 to 10 people deep in a 2 to 3 bedroom apartment. You cannot address this without addressing the disparities. And so I sadly feel it means a lot of people are going to have to die. A lot of people are going to get really sick. And then a lot of Americans are going to have to lose, see that employer-based health insurance makes no sense when people have no jobs. So then what? And that to me is sad that we have to go through that. But I also feel like it's a moment to offer a vision of a different kind of society that is more resilient, because while COVID is terrible, the climate shocks that are coming, a hurricane's headed towards Texas right now. So then it's pandemic plus wildfire, and pandemic plus tornadoes and catastrophic flooding. So then, we really need to look out for each other, and getting rid of for-profit healthcare is a great way to start.
Excellent. Yeah, it's terrifying to think of all the negative impacts that it might take to wake people up to things. And it's just like, I wish people would see that to begin with, and not.
Yeah, it's like George Floyd. It's like, I am glad that all these white folks are waking up and going, oh, this is horrible. Where were all those white folks when they were walking with, pussy hats down, like little hats, pink hats down in San Francisco, hundreds of thousands of people? Where were they when Mario Woods got shot? Where were they when Luis Gonzalo Pat got shot? No one was there. They didn't care. They continued the violent act, as Tiny Garcia says, the violent act of looking away. What is it that finally woke people up? I don't know. I'm glad that they're waking up, but it does make me realize that we have to have a degree of suffering in order to interrupt people's daily lives. Maybe it was COVID, everyone was sitting home and watching, the news. Maybe it was COVID showed how hard African Americans were having it, and then to see that was like, oh my God, not that also. What was it that finally opened the eyes of white America to the violence that people of color experience every day? What was it that got white Americans to realize that Christopher Columbus's violence, his rape, his violence and genocide that was cleared this land, the stolen land, that we are on, Ohlone territory down in San Francisco, Pomo territory, where I am right now, that violence is not something that, white America was talking about or looking at. And now people are throwing Christopher Columbus statues into the bay, which is like, oh God, thank you. Yeah, so that is great. So I welcome that. And I see this as a true moment of like a tiny moment to say, let's create a new culture together. Let's create new culture and be here on this occupied land in a new way that really brings forth the heart of our love for humanity and the earth and all people and wellness. Let's center a culture of care. Let's put all of our priorities and funding behind caring for each other so that we don't see, a brother or sister suffering in the streets and just step over them. So that violence of accepting that violence of looking away and not being heartbroken by that sight. Let's never have that. Let's stop that. And so that to me, I feel like it'll take more suffering, I think, because we still haven't gotten there. We don't have people militantly taking over hotels and moving unhoused people into them. We're not there yet. But we need to get to the point where we all say, enough is enough. We're not going to have our lives run by financial abuse. Our housing, our medicine, our education, like our food, we're not going to have the things that we need for basic survival and dignity as human beings run through systems of financial abuse.
Yes to that.
Yeah. I think it's interesting how the elites have this notion that they can ignore these whole swaths of society during this pandemic, and and not realizing that we're all connected, like that they can just ignore people in prisons, ignore people in detention centers, ignore people on the street. And I think what I hope is happening is that shift away from sort of worshiping the elites in our culture. I think it's really ingrained in our culture to like look up to rich people and aspire to be like rich people rather than sort of recognize yourself as a member of the working class and recognize that you're much closer to being homeless than you are to being a billionaire, right? So I think that's why, like we were talking about the role of the arts, like representation of working people and also people who are struggling in poverty and in all these other situations is really important, because it's like, I think one thing that's been shown right now is that America is really brainwashed. We're brainwashed into thinking that the wealthy are what we want to be like, are role models. And if it's not the wealthy, then it's cops, right? Like that's what we're obsessed with in America. So, and it prevents us from realizing how interconnected really we are and how we need to protect the vulnerable people in our society.
Well, I think that all goes back to the violence of enclosure of the commons. So when private property was created, which is not that long ago, just 600 years ago, when private property was created, and I say that in the context of 100,000 years of human, or let's say 10,000 years of human culture since the last, thawing of the last ice age. So 600 years is relatively recent. And in that myth of carving up Mother Earth and selling her off, we enter a model of scarcity, that, I need to have something for me and make sure my kids and my family and me is taken care of, as opposed to a culture of commoning again, of sharing, of understanding our true wealth is our communities, are the way we can tell our stories, the way we can share our foods and nurture and nourish each other. That's our true wealth, because there's no amount, like nothing, only the violence of, militaristic colonial structure can take that away from you, as they took that away from the indigenous people who had that. And so I think that this is really a time of looking at the systems of belief and understanding that have been here on this land, occupied Turtle Island, for over 10,000, 30,000 years, however many thousands of years, that there's a culture here that kept this place vital and healthy, and in ecological vitality and in health, and the people in health. And what are those cultural values and principles? And how can we move to a place of embracing and embodying those values and principles in a way that honors the Indigenous people and follows their leadership. And so that's, to me, really, the place of creating new culture together. Understanding that when you hoard wealth and you try to hoard land and hoard water, you'll just get more suffering. You'll just get suffering. And what you're saying is absolutely correct. We are all connected. And the arts are critical, because not only do we get to see ourselves manifested, but we get to see the vision of what's possible, which, when you have smashed the radical imagination through the programming of education that we get right now, which I'm unschooling my sons, but like the programs of education right now do not teach us how to engage our radical imaginations, do not teach us how to imagine what our purpose is on this earth and how to live from that purpose, as opposed to how to go and be part of a consulting firm and make as much money as I can. So yeah, you're absolutely right. And I love the way you said we're closer to being unhoused than to being billionaires. I think that's absolutely true.
And just to center the voices of some in the Bay who've been doing that work around decolonization and centering Indigenous voices, I Don't Know More, SF Bay, a bunch of Indigenous elders who are just amazing humans doing awesome organizing, and Sigoria Tea Land Trust in East Bay, recreating Indigenous land is great. So if anybody's interested in checking out their work, they're fantastic.
There's also, San Francisco is on Ramaytush Ohlone land. So there's some culture bearers in the area who are Ramaytush Ohlone. Sigoria Tea is doing great work. Poor Magazine in East Oakland is doing a lot of great work around decolonizing and degentrification. And so that kind of and she's an artist, Tiny, which is great. So it's that combination of, I think all of us have that capacity to see, but those of us who are really embedded in those skills and techniques can actually manifest it for other people, which I think is so important.
Amazing. Well, I have one more question, and I'd like to be able to open up the floor to folks. So if folks want to start commenting now questions, that would be great. But in that spirit of re-commenting and finding the comments together, what are some of the lessons you've learned from assembling those comments with the Do No Harm Coalition, and how can folks get involved and support your efforts?
So the Do No Harm Coalition, we formed in response to the Frisco 5 hunger strike. And so we are healers, health workers, doctors, nurses, people in training, people who don't have medical training, but have training in herbalism or other healing arts, who understand that illness is caused by these structures of our society and commit to dismantling and changing those structures in order to achieve health for our patients, for our communities. We are at donoharmcoalition.org. There are a bunch of us. We organize in a leaderless fashion, and I was involved in founding it with several other medical students at that time, and they are all doing amazing work. So, doing work around trying to get our unhoused folks housed and get them what they need, trying to help use what we call our white coat privilege to advocate for the decarceration of our society, trying to work to abolish ICE, these things where, we know we have data on the health impacts of these structures of violence, going and using our voices and our advocacy and our direct action to try to achieve those outcomes. Since this George Floyd moment, there has been a rapid increase in interest in the Do No Harm Coalition. So lots of healthcare workers jumping in, which is great. And then people asking to organize autonomous units in other parts of the country, which is also great. So come check out the website if you want to get involved. Just there's a contact there, and we'd love to work more with artists. I'm actually trying to organize a training for physicians around racism using theater tactics. I was trained as an undergrad theater. So maybe I'll call upon Mime Troupe to come help with that, because that would be amazing to do, to help train us in other ways.
Oh my goodness, that's amazing. Yeah, I've done some work in theater of the oppressed, playback theater, some of these drama therapy type techniques that imagine theater as a form of healing. So that's really fantastic. Yeah, please be in touch.
That'd be amazing.
I see a comment in the chat. Folks were saying our conversation relates to care rationing for older and disabled folks, and thinking about how we value care, that kind of care in our society.
Oh, we totally, so another person doing amazing work in that regard is the Health Justice Commons. So that is Mordecai, an amazing activist and person who's been, chronically ill at times in his life, and encountering the medical system and understanding where the places of depersonalization and disrespect are in the medical system. So he is working, I should say, are working very hard to gather people around. So they started a hotline with the Health Justice Commons, so people have a place to call to report medical abuse. But I think that folks who are disabled or chronically ill are the ones we should be listening to first and foremost into how to restructure our healthcare system. So the people who have the most need and the most, who are most impacted by these systems.
Yeah, I know Senior and Disability Action does organizing around that as well. And I think there's a lot of work now challenging the notion of disposability and the ableism that's very built into our culture and our medical system, of like who we care to make an effort to save and who we kind of ignore.
Yeah, and then that goes to like a really interesting question around resistance of capitalism, right? So if we look at who was resisting the enclosure of the commons and the nascent capitalism, those women were called witches.
Mm-hmm.
And then who was resisting the taking over of their lands, those people were called savages. Who's resisting the pipelines now? Now we're domestic terrorists. And so how this language get used to when people resist the capitalist project. And so if someone is disabled or not able to participate in the economic productivity of our society, how are they viewed? And I think that's part of the same sickness of disregarding the value of life and beauty. And with someone who's disabled, it's just the fact of their physical reality that becomes a resistance to capitalism. They're not going to be necessarily economically productive in the same way. And so this resistance to this violent system happens in our bodies. And I really believe that's why so many people who encounter these systems are the most important to be listening to.
I also want to add there that I feel like at the start of the COVID and shelter in place, people, mutual aid became kind of a big talking point. These mutual aid networks developed. And I want to emphasize that a lot of the folks who kind of started those and that movement around mutual aid began often in communities of disabled folks, and particularly disabled folks of color. And there's a long history in East Bay of that organizing. And since we're doing this panel through San Francisco Public Library, and always we want to shout out books as well, I wanted to offer Leah Lakshmi Peepsna Samarasinha's Care Work. Is a really great book around dreaming disability justice, is the subtitle of it.
Cool.
And it's a fantastic piece, and anybody can listen to it on if you're part of San Francisco Public Library, it's on Hoopla, so you can listen to the audiobook for free. So
I love Hoopla. Hoopla is saving me right now.
Totally. So
I'll have to put that on my list. Yeah.
Care Work. Yeah, it's a fantastic book. So I want to offer that to our listeners if folks are interested in thinking about mutual aid and disability justice in this current moment. It's fantastic. Any other questions that we have from the chat? If not, Marie, were you about to add something, or?
Oh, well, I just wanted to say since you worked in relation to the Frisco 5 thing, that was such an exciting moment in the city. I remember it well. And we actually got to bring in Equipto, who was one of the Frisco 5 and a local hip hop artist. He came in and did this amazing presentation for our youth theater project years ago. It was maybe a year after that happened. And it was like this multimedia presentation where he told the story of the hunger strike, but also integrated his music and brought a bunch of his like musical collaborators. Great. It was super cool, especially because we, you know, as the teaching artists to these high school students, we'd be like, yeah, we try to like integrate all these radical politics, but then for them to see someone who really like put it on the line and then was also an artist, I think was really impactful. And so definitely grateful to him for having come and done that.
Yeah, I love Equipto. I just have so much love and respect for him. I also think there's something really profound for me when I was working and accompanying them as a doctor, where I understood that, you know, my body was being used as an act of political engagement because their bodies were being used as an act of political engagement in a hunger strike. So when our patients are putting their bodies in the way of this harm in order to address a disease in the social body, you know, that these people, you know, cops coming to kill Luis Conguara Paz, just like executing him on the side of the building within seconds of seeing him. That's a disease in our social body. That's, and that the fact that, you know, so many cops have killed so many people in San Francisco and no one's been tried for murder. No one has been accountable for murder. So like there's a sickness in our society, and when our patients, when our colleagues, our loved ones in our community put their bodies in that way, our bodies in that accompaniment become humbled in destroying the false dichotomy of doctor-patient that is part of the, you know, Western medical paternalistic view of medicine, and we become comrades in a struggle for the dignity of our people, all people, for the dignity of our city, for the wellness of our community. And that was for me as an artist and someone who studied theater, and that was a really profound moment for me because it was finally a place where the fusion of my work in music and social movements and medicine came together. And so from that place, it's changed the trajectory of my work and my career, which I've been very grateful for.
I'm thinking about right now how for those who have the luxury of working from home or who are engaging in so many ways through just these Zoom technologized platforms all the time, how these can make us feel disembodied in some ways. And I really value the art, the music that I like when people host dance parties on Zoom, when people are doing concerts on Zoom, art in this time that makes me feel embodied in some ways. And so I appreciate any chance that I can be more than just like a torso on the screen.
I know.
All the better, all the better. I'm wondering, I'm curious if y'all have any closing thoughts that you want to share before I give a little plug for our next episode. If as a closing thought, you might want to offer something that you're doing for your own health during this time that can be so draining and so scary for a lot of us. Any closing thoughts that you have to offer would be beautiful. And we can start with Marie.
Yeah, I'd just like to shout out my love and solidarity to what's happening in Portland and what's likely to be happening nationwide. I hope that we can come together and recognize this moment and act on this moment in a way that creates sustainable change. As far as the self-care element, I think, yeah, dancing is very effective, and also volunteering. I know the Food Runners Prep Kitchen is a really easy volunteer gig. It's very safe and very clean, and they do need volunteers. And it kind of helps you like practice your social skills, because you almost never see people you don't know anymore if you're in full quarantine, kind of like I am. So yeah, that's a great way to feel a little better and embodied.
Excellent.
That's awesome. I just want to thank you and apologize. I was so late. I'm glad that I got to be on this beautiful conversation. And I just want to honor and thank all the warriors who've come before us, all those radical revolutionaries who've done this work in occupied Ohlone territory for so many years, and to uplift their work, and that we follow in their footsteps and we advance this work for kindness and truth and love and wellness for our community, that we work hard to create a culture of care, and that we understand that we're against 600 years of violence in doing this, and that this will take time, and it should be done with love and vision, and bold vision that is courageous and unafraid to really articulate the dynamics of historicity and power that got us here. So for myself right now, I've been actually writing a book about all this stuff. I'm writing a book with one of my favorite humans, Raj Patel, who is an economist and professor in UT Austin now. He was in San Francisco for many years. And we are writing a book called Inflamed, a call for deep medicine. And it's a look at how the history of colonialism has impacted our bodies, our societies, and our planet, and how these same structures are causing everything to be inflamed. And so we offer in the book, as we're writing it, visions of deep medicine, like what that would look like. So instead of just giving people insulin, getting at the root cause of why we have so much diabetes. And I feel like that research and writing has been extremely challenging as I watch the world just echo all the dysfunction that we're writing about. But it's also been very healing because I can see the way through. I can see the vision for another way. I can see it. I can feel the contours of it. So I would say using the imagination, finding those places in your life where you engage your imagination, whether that's through listening to music or dancing, moving your body, meditating, singing, writing in a journal, but just allowing your mind to unwind and imagine what's possible, imagine that world. And so I know it's going to come with a lot of struggle and challenges, but if we can be in it to win it with a good heart, which I think most of us have, I think we'll be fine. And so that's what's been nourishing me. And then walking in the forest.
Yes, absolutely. Well, thank you so much for being in it, for being here today and joining us, and for putting that work into the book. It sounds really fantastic, and I'd love to read it when it comes out.
Can't wait.
Yeah.
Well, thank you so much, Rupa, and thank you, Marie, for this delightful conversation. I had somebody in the chat ask, will there be a conclusion to Novice Nurse, Susie Terse? And yes, there will. We do 2 episodes on each topic, so we'll be having another episode with Susie Terse in another 4 weeks.
And plus the 9th episode where they all converge. So we'll see more of Susie, definitely. We'll see what happens with her.
Will she get the vaccine? Will she be able to solve the mystery of COVID-19. So stay tuned for that. Every 2 weeks, we're going to be having these panels through the San Francisco Public Library. So our next one will be August 8th, and that is going to be a panel on policing and racial justice in the Bay Area and beyond. And we'll actually be thinking coalitionally and moving beyond Bay Area activists to hear from folks around the country. So I'm excited for that conversation. You, as always, check out our episodes at sfmt.org to listen to them. And again, we have Freedom Land, our 2015 show on policing and racial justice is also available till tomorrow on our website. So an enormous thank you again. Thank you, SFPL, and thank you all to you for tuning in today. Hope you have a good afternoon.
Thank you. Bye.
Bye.